Hi, my name is Dr. Sherry Sakowitz. I am a pediatric obesity medicine specialist here at Valley. I've been here for 10 years. I'm board certified in both pediatrics and obesity medicine. I am in charge of the Healthy Lifeways program, which is Valley's lifestyle modification program for children. I'm also in charge of the new bariatric program for adolescents. And I'm going to talk to you today about our new program and just pediatric obesity in general. Question number 1, what is pediatric obesity and why is it a growing concern? Let's start with what pediatric obesity is first. So pediatric obesity is a complex chronic disease. It is caused by a combination of genetics, behavior, and environment. What's really important is that it is a disease and it is not anybody's fault. It's not from a lack of willpower, it's not from a lack of self-control, but it is when somebody has a hard time regulating their weight. Sort of like when someone has high blood pressure, they have a hard time regulating their pressure, and when someone has diabetes, they have a hard time regulating their sugar levels. We're seeing a growing number of kids having obesity today. So if you look at the numbers or the prevalence of obesity 60 or 70 years ago compared to today, it's tripled or even quadrupled in certain age groups. And the reason why it's a problem is because when you have too much fat on your body, the fat causes inflammation and dysfunction of organs. And what happens is it increases your chances of getting a lot of the chronic diseases that we see that are associated with excess fat, like diabetes, cardiovascular disease, high cholesterol, fatty liver disease, and of course some of the psychosocial problems that we see with an excess of fat, like depression or anxiety or even lack of self-image. People just aren't themselves when they have excess fat on their bodies. So question number 2, when should parents consider medical or surgical options for weight management in children? So when we talk about management for obesity, we're talking about 3 different things. We're talking about lifestyle changes, medical changes, and surgeries. So it really depends on the starting weight of the child and how much weight they need to lose and what problems they're presenting with. Everyone gets lifestyle changes. We try to start with medications to see if we're successful with that, and if those don't work, then we go straight to the surgery. Question number 3, what lifestyle changes can help prevent or manage childhood obesity? Everyone should be educated on what is a healthy meal. Of course, activity is really important. I recommend that all kids take part in at least 1 hour of activity every day, which includes strength training several times a week. We talk about sleep, the importance of sleep. When kids don't get enough sleep, their hunger hormones are increased the next day and they tend to crave more carbohydrates. We recommend that kids limit themselves to less than 2 hours of screen time every day. And of course, parents should act like role models and should plan activities that include activity rather than planning activities like to go to the movie theater. And it's really a family-based lifestyle modification that works the best. Question number 4. What are the potential benefits and risks of pediatric bariatric surgery? We have data from the Teen Labs study that was studied people 10 years after surgery, and we saw that the average weight loss was about 20% after 10 years, and more than 50% of the cases of diabetes, high blood pressure, obstructive sleep apnea have completely resolved. So we have great data, and there are very few complications, and we get a lot of benefits from having the surgery. Question number 5. How does Valley Health System support families dealing with childhood obesity? So first, we have our Healthy Lifeways program, which I established about 10 years ago, which is a lifestyle modification program for families. Really excited to announce that we have this new bariatric surgery program that we will filter some of our patients that need to get surgery. So we are a multidisciplinary program. We will be offering everything from lifestyle modification to medications to surgery now at Valley. Question number 6, what resources are available for children and families seeking weight management support? So we have all types of support at Valley Hospital. We have pediatricians, weight management specialists, psychiatrists, psychologists, exercise therapists. We have cardiologists, gastroenterologists, obstructive sleep apnea or sleep specialists. Any kind of specialist that we need, we have at our fingertips. Of course, bariatric surgeons, anything that a patient may need, we are able to provide. For more information, please contact our office.